Hi, have you heard any talk about long term COVID 19? I've started to hear some things and wanted to talk with you about them today. What are some of the symptoms of long term COVID? Hello, my name is Donna Denson. I'm the Dynamic Diabetic, and I'm happy to be here today to provide you with some information on long term COVID 19. It's a thing. It's already clear to doctors that some patients, even after they recover, have some long term issues and conditions stemming from their contact with COVID 19. And we're just beginning to understand what they are and how to treat them. So today I want to give you 9 symptoms of long term COVID 19 issues. And so, if you know someone who has had COVID, this would be very important to them to know what to watch out for. Knowledge is power. I like to give you all the power that I can as the diabetic. And so, I'm happy to let you know about this because it's so new today to all of us. And we all want to know and understand what is possible, right? So, the first symptom would be trouble swallowing. And difficulty swallowing can have stemmed just from having been on a ventilator so long. And it's not uncommon for people who've been in ICU to have that long term effect in trouble swallowing. But COVID patients that were on the ventilator for a good while are definitely having that issue a lot. The second one is deep fatigue. I'm talking about just wipe you out fatigue. And they also believe that that is from long term, like being in bed for a long time. So most COVID patients who are really ill are spending roughly 8 days in the hospital. Well, guess what? After 8 days, you could lose up to 12% of your muscle strength. And so you could definitely be feeling that fatigue. The worry is that it's not going to go away. The third symptom are lung issues. COVID 19 is a respiratory disease, so we know it's going to compromise our lungs, right? We know that. But there are 3 additional risk factors, right, that can make this even worse and make it long term. The first would be having a really severe case of COVID 19 that lingered. The second would be having pre existing conditions like COPD or heart disease or diabetes. And number 3, anyone who didn't receive really good care when they did have the virus, they are also at risk for long term lung problems. Okay? Trouble breathing for the long haul. Number 4, neurological problems. They're finding that some previous patients are dizzy, they get headaches, they get confusion, they even have their behavior change. And so the doctors are thinking that there's some kind of structural damage to the brain that can be happening during COVID as well for some patients. And this is becoming a big concern because they don't see anything that's obvious that's causing this. Okay? The 5th symptom is shortness of breath. And even, here's the scary part of this, even people who had some milder cases of COVID have had issues linger on about shortness of breath. That's a sign of the virus itself. But afterwards, when you've recovered, now you're having shortness of breath and you're going to the doctor later to say, what is this? And so again, they're afraid that that could be a sign of lung damage, but it's not showing up on anything yet. They can't find the cause of that yet, the doctors. Number 6 are chest x-ray shadows. Okay, this is another mystery for doctors so far. Previous patients are coming in and they're having chest x-rays that are still showing shadows, but not anything that a doctor can identify the cause of. And so they're really, it's kind of up in air and up for debate right now. How's the best way to handle that? Should they treat, not treat? How should they treat? Very confusing. Number 7 is abnormal blood clotting. You know, your blood, as you get older, people have more of a problem with blood clots and having strokes and heart attacks because of that. But now they're seeing young people who have had COVID suffering strokes, and they're very concerned because COVID makes blood cells, it seems, clump and form clots much easier, and can cause liver and kidney problems as well. So this is a big concern because young people having strokes, that's not normal. So there's something that has changed with that. And this is not everyone, please. This is not everyone has all these issues, but these are the possible things that some people are definitely having. Autoimmune response. COVID seems to attack on our nervous system and makes it act like an autoimmune disease. So there's not many that have had this problem. This is a small number, but it seems like COVID has caused pre-existing mental issues to come to the surface and become worse. And that's part of an autoimmune response. So that's another thing that doctors are watching very carefully to see how many people are having these problems. Number 9, and our last symptom, is organ system failure. They think that severe COVID and prolonged stays in the hospital are leading to this, causing the multi-organ system failures that would affect your lungs, your heart, your kidneys, liver, and more. So they are studying all these symptoms, guys, to see if they can find a way to eliminate them, to help people get over them. But right now, the doctors they're looking for the long-term symptoms, and they're looking to have long-term care. And I don't mean like in a nursing home. I mean just having people who've had COVID continue to come in and be monitored because of these kinds of issues, and to make sure that they're not having them. And if they are, that they can do the best they can to take care of them for them. This is a serious subject that has not had much news. It's not had much sharing going on. So please share today's video. These are things that people need to know. Again, knowledge is power. I believe we need to have the power of knowledge, especially in something like this. There's so much we don't know that everything we do know is valuable. So if you know anyone who has had COVID, definitely share this with them. Definitely share this with them so they can be aware of maybe something they're experiencing is related. Okay? I appreciate that very much. As always, share, share, share. And if you haven't subscribed to my YouTube channel, please do. I don't know why you haven't, but I'm glad you're here. I really am. I hope I found you safe today. I hope I found you well, and I hope I found you happy. My goal is to give you all the knowledge I can so that you can get healthy and stay healthy. My name is Donna Denson. I am the Dynamic Diabetic. Thank you so much for being here. May God bless and keep you until we connect again. Bye-bye.